Well, let's now focus on Gauteng. The provincial government here warning that we are very close to the peak in terms of daily infections. We know it was predicted to be around early July. The province, of course, the epicenter for the third wave. Latest figures, as I just mentioned, 22,443 across South Africa. 11,680 of those in Gauteng alone. Well, to tell us a little bit more, I'm joined now by Professor Bruce Mellado, a member of the Gauteng Premier's Advisory Committee on COVID-19. Prof, thank you so much for your time. I know that you're constantly modelling, constantly looking at the story that the numbers are telling you. Are we at the peak, near the peak, plateauing? What's the picture in Gauteng?
Thanks for inviting us, Sally. Yes, the situation that right now, as predicted by the modeling, is that we are peaking as we speak. As a matter of fact, the number of new cases we'll get this week will be slightly less than the previous one, somewhere about 10% or so. That means that we are peaking as we speak, or the peak has just happened, so to say. But that being said, the message we want to bring about is not that we are out of the woods, far from it. Actually, quite the opposite. The numbers are very, very high, and what we're very concerned about is the fact that the pressure on the hospital system will keep mounting. The fact of the matter is that the peak of hospitalization is reached about 2 to 3 weeks after the peak of the number of cases. So if we peak this week, that means the hospital system will still be under tremendous pressure for the next 2 to 3 weeks. I understand that as of today, there's over 8,800 patients in hospitals in Gauteng at the moment. So it's clear that we're even going to cross the 9,000 mark.
Yeah, I mean, it's astonishingly high. So you say we're peaking as we speak. How do we know that we won't just sit at this high level and sort of plateau at this peak before we drop again? How do we make sure we at least start coming down the other side? Or have we begun that?
That's a very good question, in fact, and this is one of the reasons that we are very, very cautious about saying that we are out of the woods. We certainly are not. And the reason for that is that, A, we have a lot of mobility, B, we have low levels of adherence, and C, and probably most importantly, we have a very contagious virus. So we can't relax, because the fact of the matter is that if we relax social distancing measures or adherence to social distancing, or we relax measures too fast, what we can have is a dip and then another peak, because there's sufficient number of people to be infected, and bear in mind that this Delta variant is already being proven to be more contagious. So as long as the level of adherence to social distancing remains, we hopefully should see a drop in the number of cases. Now, if you look at the detailed picture of what's happening in the province, already some of the sub-districts, some sub-districts of the city of Tshwane, Johannesburg, and Citibank are already going down.
I see. Nearly 2 weeks ago, the President moved us on to lockdown level 4, primarily because of what was happening in Gauteng and an attempt to stop it spreading so quickly to the other provinces. We had a leisure travel ban imposed. This Sunday will mark 2 weeks. The President said that he would reassess after 2 weeks. Do you have a sense of what the best advice is to give the President about whether we should extend level 4 a bit longer?
Right. So what we do as a committee is to assess the situation and the projection. So we, as you correctly pointed out in the beginning, we look at the data very actively on a daily basis. We update models, correct them, and make sure that they are well calibrated. So what is clear is that, A, from the point of view of the hospital system will still be under a lot of pressure, tremendous pressure, for at least 2 to 3 weeks. It will take about 2 to 3 weeks to go below the 50,000 mark of active cases. We are now about 95,000, and that's still a very big number. Bear in mind that during the second wave, we didn't reach 50,000, and that's a very big number of cases, and it will take 5 to 7 weeks. If we don't change our behavior, to basically go to numbers that are under control. So the situation is far from being under control, and we're certainly not out of the woods.
All right, so I'm hearing from you that it might be wise to continue those level 4 restrictions. And also, of course, if we look at the rest of the country, the Western Cape is now on 3,215. That's quite a jump even on yesterday. And although they are prepared and they have got a higher seroprevalence than us here in Gauteng, because they had worse first and second waves than us, there is extreme concern there as well because of this Delta variant.
Absolutely. The reality is that if you look at what happened in Gauteng, the first half or the first few weeks of the third wave, the growth of the number of cases, the acceleration was not very strong because the Delta variant had not become dominant, but it became dominant very fast. It was an exponential process, and around mid-June, what happened is that in the middle of this widespread community transmission, the Delta variant becomes dominant, and then a very strong acceleration in the numbers takes place. So it's very clear that the Delta variant is highly contagious, and high levels of lack of adherence to social distancing has devastating effects. So the virus will spread very fast, whether it is in Gauteng or elsewhere.
I have to ask you about the deaths. You say that we should expect, we're probably peaking right now in Gauteng, we should expect at least 2 to 3 weeks more intense pressure on our hospitals. We've seen astonishingly high death rates in the last few days, 374 today, but we've been over 400 for the previous 2 days before that. And of course we're mindful that we have lost Johannesburg's first citizen, Jeff Makubo, today. Absolutely tragic. One, sadly, of many deaths. Can we expect, must we prepare ourselves for the rate of deaths to stay this high also for the next 2 to 3 weeks?
So, okay, we have to decouple the question into different sub-questions. So if you look at the numbers and also advice from experts, it appears that the Delta variant doesn't produce more mortality or more hospitalization, meaning the probability of being hospitalized or dying because of you contracting the Delta variant does not seem to be higher compared to the Beta. But the problem with the Delta variant is that it is very contagious. As a result, it creates a very large number of people that are positive in a short amount of time. That's really why more contagious viruses are so dangerous. So even if we assume that the virulence of the virus is not worse, unfortunately the number of people that will pass away will be greater compared to the second and the first wave, just because we have a lot more cases. It's true, however, that because about 40% of people above 60 have already been vaccinated in Gauteng, will certainly have a positive effect from that, because we know that about 2/3 of mortality comes from people above 60, or at least excess mortality. But unfortunately, as of last week, as of July 3rd, the MRC reported a very large number of excess deaths already. So that basically indicates that we are actually in a tough situation.
All right. Well, thank you very much for telling us. At least we know what we are in for. That was Professor Bruce Mellado, member of the Gauteng Premier's Advisory Committee on COVID-19.